We're really lucky to have you all join us for our Pride event today. Happy Pride, everybody. Thank you all for joining on a Friday morning all around the globe, at least Friday morning here on the East Coast of America. My name is Nandi. I am the chairman of the board of directors for South Asian IBD Alliance. I'm also an IBD specialist at the University of Pennsylvania. And here today we have several guests who are going to help us focus on the intersection of pride, sexual gender identity, and being South Asian, okay? And we're going to talk about a whole host of different things about how this touches human health and being human. First off, I'm going to have my guests introduce themselves. One of our first guests I'm going to introduce is one of my clinician colleagues, Dr. Kumkum Patel. Kumkum?
Hi, good morning. Thank you so much for having me. I'm Dr. Kumkum Patel. I'm a gastroenterologist in Southern California, and I focus on irritable bowel syndrome and esophageal motility as well as anal rectal motility. So I take care of people's pelvic floors as well as their swallowing issues. I'm super excited to be here.
And then we have two fabulous patient advocates. And here at SAIA, we believe that the voice of the patient leads first, leads and informs everything that we do. I'd like to start by introducing Madhura.
Oh, thank you so much and happy Pride, everyone. I'm Madhura Balasubramaniam. I'm a Crohn's disease patient and I'm based in India. And I'm so excited to be here today to talk about the intersections of Pride and GI. And of course, I'm part of Team SAIA as well.
Madhura does many things for us at SAIA. We appreciate it very much. And then last, but certainly not least, a very special guest, Ravjot. Ravjot?
Hi, everybody. Happy Pride. Thank you so much for having me and allowing me to speak freely in this space. My name is Ravjot Mehek Singh. I am a filmmaker and art activist, and I've been in the film industry for about 10 years now. And I'm a little bit of a complex, CRC patient, and it was caught really early on. So I'm really excited to be sharing my story and sharing the intersections of how my story lines up with my queerness.
Thank you so much, team, for joining us today. Gang, if you're just tuning in, please definitely, interact with us, ask questions. We have, wonderful guests here. They can speak firsthand. We love hearing your questions, your experiences, and we'll try to actually incorporate that into our conversation as we go along. So first off, we are at SAIA an intestinally focused organization, and we have our focus on Crohn's and colitis, in which there's also an increased risk of colon cancer. And so part of our mission in tandem, honestly, is whether you have IBD or not, is spreading that awareness about colon cancer prevention, which really doesn't happen in the Desi community or South Asian community at large very much to begin with, for multiple reasons. Just to get a common understanding for what it is that we're dealing with, and then I want to turn it over to our patients. I'm going to ask Dr. Patel here, Ravjot actually had, at a very young age, I'm not going to take away her story yet, a diagnosis of something kind of scary that was, increased risk for colon cancer. Dr. Patel, can you tell us a little bit, why am I being formal? Kumkum, can you please tell us a little bit about colon cancer prevention? Why does it matter? Do Desis get it or not?
Yes, absolutely. So colon cancer, as you know, comes from polyps that are precancers that turn into cancer. And in the United States, we recommend that people get colon cancer screening done at the age of 45. This was recently lowered from the age of 50 down to 45 because more and more young people are actually getting colon cancer. And a lot of that has been attributed to sedentary lifestyle, more processed foods, but there's also genetic factors. Now, the problem is that even though this age has been decreased down to 45, people are still not getting colon cancer screening done as often as they should, and even access is a problem because oftentimes it is stigmatized. And unfortunately, in the South Asian community, even seeing a doctor for any reason, whether it's preventative or not, doesn't happen very often, right? A lot of times our South Asian parents are like, I'll only go if I have to, but preventative things are just not done. The good news is that the actual incidence of colon cancer in the South Asian population is quite low, but despite that, our people themselves are not necessarily going and getting screening done because of a variety of reasons.
So if I'm listening to you correct, colon cancer is common, it's preventable, it's preceded by polyps that we can remove, but many communities, including South Asian communities, have under screening because of stigma is a main driver, and maybe lack of knowledge that they're at risk for colon cancer, even though it's the third most common cancer in the world, second most preventable cause of death from cancer. So that's a real shame.
It
Uh,
really is.
ask you, you are much younger than me, my little sister, but you were even younger, right, when you started your journey into this GI territory. Can you tell us a little bit about your story that I know you shared um, uh, vocally and in an advocacy way before, but can you share to our viewers what your story and path has been in this route, in this area?
Yeah, so when I was very, very young, I was 18 years old. To me, that's 18 is not an adult. 18 is still a baby. We're still figuring out a lot in life. I was extremely sick and kind of had like textbook symptoms of colon cancer. And at that time, there just wasn't really much literature out there to support young people having it. Because I'm talking about something that happened 12 years ago. And back at a time where just like social media wasn't around, people were not sharing their stories. So I felt in my gut, literally, that something was very, very wrong. I was actively dying of a lot of different symptoms, whether it was extreme weight loss. And when I say extreme, I was truly like a skeleton. It makes me sad to see pictures from back then. I was always on the verge of fainting, probably because of the weight loss, severely anemic, couldn't digest food. It was a whole slew of things that really should have, at the very least, provoked some further investigation, like at least a colonoscopy. But it took me a whole year plus, bouncing around from doctor to doctor, and including brown male doctors who also dismissed me. So our own South Asian community, like they weren't really on our side either at that time. I had a lot of support from my parents who definitely didn't think that it would be, polyp related or CRC related, but we knew that it was something. And we all kind of pushed together. It was when my dad started coming with me to doctor's appointments that someone took me seriously. And so I finally encountered a wonderful GI surgeon who believed that something was wrong. Again, they still didn't know that it was going to be what it was. And when they finally did a colonoscopy, which I was super scared about, but now I'm very vocal about advocating for because it's actually really simple and it can literally save your life as it did for me. They found a huge number of polyps. I think it was like 23, 24 or something polyps, and some of them were centimeters large. And they were just looking really, really bad. But luckily, they caught it at the stage that they did. It did not metastasize, and unfortunately, every year they do reoccur at pretty large rates and pretty large sizes. So my only path to really existing from now into the future is colonoscopies every single year and polypectomies every single year and staying cancer free by just getting them removed the old fashioned way. So that is a little piece of my story.
Ravjot, thank you. I mean, that just listening to you firsthand, hear you speak about it. I mean, it's very upsetting. Thank goodness that you're okay and that you found a good doctor. We were talking before the live, and there's a couple of themes that I think are important to pick out that I think everyone needs to kind of reflect on, right? One, you were a young person, and if I was a doc listening to you, I'd like to think as an IBD specialist, I would have thought, oh my gosh, she might have some form of IBD. We got to scope her. We got to do tests before I even thought of cancer in such a young 18-year-old. But I think there's a couple of things. One, you had severe symptoms, like benign things don't cause weight loss. Scary things do, right? That should have been a red herring. So that means you were dismissed, right? You were dismissed by several docs. You mentioned South Asian docs, and we stereotyped them as being smart. Not so smart right there. They really dropped the ball there. And I'm glad you met somebody, right? You met a colorectal surgeon, right, who advocated for you, diagnosed you, and got you back on the track. Now, colonoscopy every year is not great, but like you said, right, you're being mature about what you got to do, right? You got to do what you got to do. So that's a big kudos to you. In this journey, was there any, was sexuality or gender identity ever a barrier or an issue? Did that ever come up in that conversation or not? Or was it ever addressed?
I remember initially bringing it up to a couple of the doctors that dismissed me, and unfortunately, it kind of got it made I feel my treatment worse in the healthcare space, especially again, we're talking about something that happened 12 years ago, and things have luckily progressed like a lot, I'd like to say, and I live in a great state now where things are a little bit better. But back then, I think they used my identity as a way to kind of pin all of my symptoms on general mental health disorder or some nonsense. I remember they used to sweep me under the rug a lot by saying, oh, a lot of these symptoms are just you facing severe anxiety. And I'm sure it was part of that. But you know, why was it part of that? Because there was something very real going on that I didn't have any control over getting solved. So it did come up, and because of those experiences really early on, I feel even today a massive hesitation in saying what I am and saying anything that could more easily make them think that I am a mentally unwell or unstable person, because that's not something that I am. And I'd hate to have my many other symptoms and issues also dismissed the way that, you know, this CRC journey was dismissed early on. And I think there's a lot that we could do about that, which mainly starts with maybe the training of healthcare professionals. And maybe even more panels like this, or having queer folks and trans folks especially come in and speak with doctors, and not only doctors, but nurses, researchers, everybody in the healthcare field. So there's a lot that we can do about it, but certainly I was not comfortable initially sharing my story after those first few instances.
You know, it makes my blood boil, and listening to you say that, you know, although we believe that times have gone forward, 12 years have gone by, they have and they haven't, right? We have still more to do. I think things have improved in the training of docs. We're going to come back to that point again, but it breaks my heart that you still have to hesitate, right, for disclosure. And it sounds like they passed judgment on that, which is really unrelated to the clinical diagnosis. It's important to understand who you are as a 360, as a human being, right? That's important and part of being a clinician. But it sounds like, from your experience, your perspective, it clouded their judgment in giving you access to a procedure, right? That could have gotten you the treatment that you needed much earlier. Is that right?
Mhm. Absolutely. I
Let me,
definitely think so.
yeah. You know, Kumkum, what do you think, you know, about, a couple points that Ravjot brought up, I think are really important. How has the training of our clinicians, GIs at least, evolved in terms of taking a sexual health history, or addressing this, or being cognizant of that? That's one question, right? And then I'm going to ask you a little later, as a heads up, like how you approach your own patients. What do you think at large about that training? Has it come forward or not? And then separately, how do you make your patients comfortable talking about sexual health and identity?
Thank you so much for asking. You know, one of the things I think that, you know, we've had a lot of changes politically in our country, and I trained not that long ago, and you know, now just societally, right? Because of social media and everything else, we are learning that people have different sexual preferences and how they want to be addressed. And I think my generation of physicians, whether it's being taught or not, are trying to make a better effort to say, okay, how would you like to be addressed? What gender, orientation do you want to be referred to as, and how is that affecting you? Unfortunately, not everyone is personally taking that on and learning how to incorporate that in their practice,
Mm.
but there are physicians who are doing it. And I really want for patients to know that if it is not addressed, it should certainly be brought up by the patient. Hi, my name is so and so, this is what I identify as, and I'd like to bring it up with you. I want people to make doctors aware of it, because sometimes we're not even aware that it should be addressed, and it hasn't been taught as well, but it is getting there. It's progressing. It has changed in the last decade or so, but you know, we still have room to grow in terms of how we can teach physicians on how to address that, and how to make sure that patients are made comfortable in bringing it up on their own.
Mhm.
No, and I think that's really important. I think it has come a long way, but it's certainly not standardized. I'll tell you, Ravjot, that, you know, I probably got one, maybe two lectures in all of early medical school on how to take a sexual health history, and maybe one or two sessions as a resident, and then never again. And I didn't really start to develop any curriculum of my own or training till I was a full-blown attending 14 years after starting the journey to becoming a doctor. And now it's a part of what I do, but it wasn't something that it was structured and people were reminding me to do. It was something I had to learn from my own patients to really take a health history. I'm lucky I live in Philly in the city of brotherly love. And so I had really good patients and role models to learn from. So actually my patients really taught me most of what I know about how to take a conscientious and empathetic sexual health history. What I do in my practice, honestly, is I'm a Crohn's and colitis doc, so not every visit is focused on this, but when we find that well visit, or we're talking about the impact of the disease, that's when sexual health comes up, to be honest, mostly. But if there's like a well visit, we'll talk about it. Like instead of being, hey, you're great, you're in remission, see you later, it's more like, hey, let's talk about other stuff. Let's talk about preventative health, talk about Gardasil vaccine, we'll talk about sexual health, barrier protection, etc. That's when we'll ask. And the pattern that I use, if I have any clinicians listening, I say, hey, I want to ask you some personal questions, and I want you to know I ask all my patients these questions. So, if at any point you may feel uncomfortable, I understand, just let me know. But I want you to know it's a standard part of my practice. And it sounds very sterile, but it kind of has to be sterile, practiced, rehearsed. And then, of course, come from the heart, right? And then I also make sure that any conversation that I think there might be any conflict or anxiety that might be provoked, I never, ever sit across from them, ever. I always sit next to them so that we're having a conversation. Otherwise, body language looks confrontational. And I always make sure that my hands are to my side. And even if I have to sit on my hands, okay? Some of us like clasp tightly, but I always sit them. That's really key. And the last thing I do is, if I ask and I get a pause and it seems uncomfortable, I do my best to shut up because, as you can tell, I talk a lot, right? So I always I try not to fill the space with more sound for my own uncomfortableness or awkwardness. I try to be quiet and let them gather their thoughts because they're probably shocked I'm asking these questions. And so they have to have time. So what I'm telling any clinicians, or patients who want to educate their docs, okay, like my patients have taught me, right? These are the things that I think that are practical that a doc can learn from.
I love
Madhura,
that.
yeah, thank you. Madhura, can you share a little bit about your journey as an IBD patient, as an IBD advocate, and as someone who's growing up right there in India in Chennai?
Okay, I love this conversation so far, can I just say? And I love how open and honest, Ravjot, you were with your experience and the doctors for sharing your tips and tricks for how to make patients comfortable. This has not been my experience so far, but though I have a lovely GI right now who's an ally. But just to kind of backtrack, so similar to Ravjot, I was diagnosed only at 24, but I'd been symptomatic from the time I was 4. So it took me a good 20 years of being diagnosed. Similarly, super underweight, super malnourished, and it was all apparently in my head and my mom's head, and it was a cry for attention and whatnot, right? So by the time I was diagnosed at 24, I was already really cautious going into doctor visits. I was trying my best not to be who I am as a person. So that means not doing I would do my research well in advance because that's how I am as a person, but I'd make sure I'm not showing my doctors that I've done the research. I would not ask questions and I would not go to the doctor. I was honestly diagnosed because my mother dragged me. So there was no question of me discussing my sexual orientation with my providers at that time. And a lot of the things that this does is that, just as an example, because you brought up Gardasil, Dr. Neil, such an important conversation for us to be having as IBD patients and physicians, regardless of sexual orientation, right? Like you should be vaccinated against HPV, but especially if you have IBD, especially if you're a member of the LGBTQIA community, this is important. So my GI had written this, my current GI had written this in his prescription that he wanted me to be vaccinated against chickenpox, pneumonia, the usual flu, and he wanted me to have the HPV vaccine as well. And I go to see this infectious diseases provider who's a woman who removes Gardasil from my prescription and just just prescribes the other three, right? And her logic for doing that is, oh my God, how can we discuss sexual health with a young woman, especially who's brought her mother along? no mind that I'm not straight. Like, there's no discussion about my sexual orientation. So there's a lot of heteronormativity I felt that's been built into my GI care, which is very sad in some ways because it's to the detriment of me as a patient, right? Like, okay, granted, I'm asexual. I was okay making that decision to say I will let go of the Gardasil because I don't want to have a confrontational relationship with one more provider. But that is not a decision I should have been put in a place to make. Similarly,
Yeah.
I've had providers tell me, like when I've been in hospital with obstructive symptoms, oh, if you have kids, the pain will go away because they attributed my obstructive symptoms to period pain. And this was like so wildly insensitive and uneducated that I was just like, I don't even know how to respond to this, right? And from that, like the reason I'm sharing this is because I think from a patient perspective, this is a lot. It's traumatizing, it's exhausting to deal with, but we owe it to ourselves to speak up nevertheless. We owe it to ourselves to advocate for what we need nevertheless. In a country like India, it can be very challenging to come out because identities are still criminalized. I mean, sure, we've thankfully, struck down Section 377, but we still don't have legal right to marriage, legal right to adopt. There's so many other like citizenship related challenges that we have. It makes it very hard to come out, but we still owe it to ourselves to ask questions in a manner we are comfortable to make sure we get the care that we deserve. And from a physician perspective, I think what the two of you are sharing in terms of letting your patients speak, sitting with the discomfort, being empathetic listeners will go such a long way in helping patients like me come forward and share our experiences.
Yeah.
Thank you for sharing that. That's incredible that you did it. And as a female physician, I think that it's important for other female physicians to allow patients, whether male or female, to talk about their sexual traumas in the past. A lot of, their experiences have been driven not only by sexual experiences, but by sexual traumas. And a lot of what I see in my clinic, because I have a pelvic floor clinic, is people who come in who've had pelvic floor dysfunction, not just because of childbirth or either long-term constipation, but that's been in there because there's been underlying sexual trauma, right? Which has then led to mental health issues and not being able to really come forward about it, right? They've had anxiety, stress around sexual encounters. Whether it's a healthy encounter now, it may have been really traumatized and changed because it was previously a traumatic one, right? And so as clinicians, we really need to sit down and say, okay, yes, you may be in a healthy relationship now, but was it always that way? Did you have anything in your past that happened that made you tense up? Has this contributed to your GI symptoms, and is that maybe a reason why you're having pelvic pain or constipation and things like that, right? A lot of pelvic floor disorders come not just because there's poor transit of bowel movements, but there is a component of sexual dysfunction that is really contributing to the pelvic floor. And so I want male patients and female patients to be able to be forthright and say, okay, this is what's happening now, this is what's happened in the past, and this is what I'm considering happening in the future. I may be getting with a male partner, or maybe getting with a female partner, and this is what I want to be forthright about. And so I really want to encourage patients to be honest with their physicians about that.
No, those are great sentiments and wonderful thoughts, Kumkum. And then, Mother, I think just having a female health professional really deny the access to a vaccine, right, that your other specialists recommended, right, making so many assumptions, right, and then and like you said, steering the clinical care to a heteronormative experience, right, just really putting blinders on, right, like, oh, doc cannot hear, taboo, taboo, taboo. I mean, these things still persist, and I think each both you and Ravjot live in different continents, right? But have shared experiences, and the degree of liberalness, varies, right? Everywhere, within India, within Pakistan, within America, you're going to meet people who are bigoted, have bias, implicit bias, right? And I think another part of this is the people that we interact with. Like, let's just take our clinician hats off and let's pretend we're not here on this live video even. When we're out in the community, we're just talking with colleagues and friends, community members, right? The way people talk, about sexual health, right? Just at baseline, right? Forget we're talking about healthcare theme, right? Just the way they talk about sexual identity, right?
Mm.
Neil, I think we lost your audio.
Yeah.
Oh no, can you hear me now?
Yeah, we can hear you
Yes, we
now.
can.
Oh, I think I'm using my hands, and Instagram said, "Do you want to use gestures?" And I it just muted for some reason. I'm
Oh God.
on gestures. Um, so I don't know what you heard me say last, but I was trying to ask our patients if they've had any experiences they can relate, just talking with coworkers, with colleagues, with friends about sexual gender and the taboo organ, the rectum. Has that come up in that lens before, Ravjot?
Oh yes. Oh yes. And thank you for giving me the space to share this piece of my journey because it's relatively new. And I want to recognize how different it would be if I was trans or if I was a queer male in particular, because I feel like often these, well, basically what I experienced to backtrack is people that two men that I work with pretty closely in pretty different fields. I shared a series last year with Dr. Patel about my journey and her incredible input on how South Asians and just how young people in general should and get tested for CRC and just advocating for colonoscopies. So my story was just like freshly out there, and I think this was literally last year around Pride Month, so extra harmful. These two coworkers of mine, they kind of in separate instances said some pretty homophobic stuff, and it was so very much fueled by the fact that CRC occurs, in the colon and the rectum, and that GI tract is such a taboo thing, right? Especially within queerness, it's such a taboo thing. So again, despite me being female, they still had these incredibly charged, terrible homophobic things to say, and it was just extremely inappropriate. I think a very layered level of inappropriateness. First off, I do not think a male coworker should be talking that way to a female coworker, period. Probably never to anybody, quite
To
frankly,
any
but
coworker.
especially,
Anybody?
yeah, especially through that lens of like gender is afoot here. Shouldn't have happened. B, for them to have been so bold to have assumed that I would receive it as a joke. And it made light of so many things. It made light of literally people who die of cancer, colon cancer specifically, right? So it was a really tough time where I was like, wow, these are two young, educated men that I see all the time. And two separate people. They don't have any interactions with each other. They're in different fields. They're feeling this way and they're saying these things and they're saying this to me as a woman. So what do they say to gay men? What do they say to trans people that they're around? If I have received these comments as a queer woman, I cannot imagine what gay men hear, especially if there's that intersection of them being gay and also having CRC, or not even CRC, but IBD, Crohn's, the many issues that exist in the gut, right? So it was a huge wake up call of like, wow. And then I can't imagine who put these thoughts in their heads. It's
No.
their parents, it's their dads, especially. We know that in the South Asian community, and some of them weren't even South Asian, by the way, these out of these two. But we definitely know that in ethnic populations, especially, I think there's a huge stigma around men specifically getting colonoscopies and what that means for their own identity and expression, as if it changes anything, as if it's something that is not medical. So I think those two instances really shook up how I approach advocacy now as well, because I'm like, wow, if y'all are making these jokes, I know your dad isn't getting a colonoscopy anytime soon, and then he's gonna, I hope not, but this is how people find out that they have like raging colon cancer when they're like 60, and it's totally something that they could have done something about if they had taken it seriously and not stigmatized it and not attached this wild homophobia to the topic. So it's just a little piece of what I experienced.
Yeah, and I think that's why it was so important to hear you talk about this because this is the implicit bias that we're talking about, right? You had educated people who should know better, right? I'm sure you worked with these colleagues and probably thought higher of them before that conversation, and they probably fell in your graces, I would think, after the conversation. But this is the implicit bias, and no matter even a clinician who might be so well educated, right, can have implicit bias that they grew up with, right? That's passed down from generation. The other thing you just said was really important, which was are the people in their family, in their network, right, who getting screened because they're stigmatizing the rectum. And no doubt, I'm sure, Kumkum, you've encountered some patients, male patients, particularly male patients, who felt that there was a stigma against having a colonoscopy. And in fact, I've had many wives have to come to me who did their colonoscopy, have me talk to their male partners about getting screened because of this stigma, and it still happens. It's crazy, right? It's less and less, but it's still happening. But it translates, no matter what education level, there is an implicit bias, this judgment of the anal rectum as that organ. And I think what we have to do here is when we finish this live stream, when you all tuning in are done with this live stream and you've been enlightened and a little bit more even with the pearls that are being dropped, as we go through our daily lives, the coffee shop, walking down the street, at the gym, how we talk is really important. People listen, people pick it up. Even if they're not listening to you or having a conversation with you, you're having an outdoor, you have to be responsible. And that's one way to be an advocate is you don't have to be on live, but just in your own community, in your family discussions, is when you hear some type of talk about this, you have to speak up, especially in the Desi community, a Desi party, right? You got the uncles and the aunties in different sections of the house, right? And you hear some type of talk like this, that is an opportunity to be an advocate in your own community and say, hey, you know what? I don't agree with you. This is not the way we should be talking about this. Uncle, auntie, like colon cancer is very preventable. You really shouldn't worry about this. And, another thing I want to talk, and I want to ask Mother her thoughts about this too. A couple of years ago, there was a horrible paper that was published, and I'm saying it's horrible, where it actually suggested that men who have sex with men had an increased risk of colon cancer. And the statistics on this paper were horrendous. They were not done properly. And the person who published the statistician received a lot of grief for it, and they admitted I believe that they admitted that their analysis was incomplete and wrong, and I genuinely believe that they felt bad about it. But it was a horrible paper because it got published by a journal that should have retracted it, honestly. Should have never let it come.
Yeah.
And I wanted to make mention of it here because I'd be amiss if I didn't. That is completely wrong. Having anorectal intercourse does not increase the risk of colon cancer in any way, shape, or form. You've heard it here. That is science. That is a complete myth, an urban legend that I can't even believe, has been perpetuated. So just want to put that out there. I also want to say that anorectal intercourse or receptive intercourse is not just a homosexual practice. It is a heterosexual practice. It is any type of gender identity practice. Yep. It is pleasurable as the pudendal nerve that innervates the clitoral head or the penile head also innervates the perineum and the anus. That's why it feels good to take a poop sometimes. Okay, people, I'm just telling you right now. So do not judge anybody for how they want to feel, what makes them feel good.
Mm-hmm. I appreciate you saying that, actually, because, I have a lot of patients, male patients, who are going to get their colonoscopy done with me. And especially if they've been vets or something else, they'll say, oh, are you going to be doing my colonoscopy? Oh, and, they might, they're uncomfortable with it. And they'll say, well, are you going to take me to dinner before you do my colonoscopy? Or, they'll say something to lighten the mood. But I'm like, we're screening for something medical. We're looking at an organ that, can develop cancer. This is not a sexual encounter. This is a medical encounter. I'm doing the same procedure, and the same organ is, present in men and women, and it doesn't change the actual anatomy of it, right? And so I think that is what needs to be addressed in both cases. And just like you have said, if there are women who are coming in with their husbands and they say, okay, is she going to have a colonoscopy? I've had a lot of women who are very conservative, and the husbands are like, oh, are you going to be doing the colonoscopy? Like, where are you going? What's happening? What this, again, this is not a sexual encounter. This is a medical, procedure that is being done and has nothing to do with pleasure or anything else. So we need to remove the two and separate the two. One is a sexual encounter that is completely okay as to how you're doing it, and one is a medical encounter that is meant for screening purposes and for medical purposes to prevent and prevent cancer. And so the fact that they can sometimes be put together is unfortunate, and we need to speak up about the fact that they are very separate things.
Absolutely. Listening to all this, I want to ask Madhura a question. Madhura, something that's come up is the dismissal, the judgment, especially if sexual identity is disclosed, right? And I gave some ideas and Kumkum as well about like how we try to make patients feel comfortable. But let me ask you, right, Madhura, if you feel comfortable, what would make you feel better supported? What would make you feel more comfortable? I mean, I honestly think the onus of asking these hard questions, the taboo topics, right, are on the onus of the clinician to lift that burden from the patient, right? We shouldn't have to have the patient speak up about it. But if a clinician is not addressing it and it affects your care, right, it affects your answer, your decision in somehow, what would make you feel more comfortable, or how would you even suggest that we talk about this as a patient?
That's a really good question, Dr. Neil. And before I go, Dr. Kumkum, that was such a mic drop statement that you just made right there. I just had to say it. Like, if I had an emoji, I would put it in there. That was amazing, and I cannot agree more. People got to calm down, do your colonoscopies, and have pleasure in whatever way makes you comfortable. So thank you for saying that. Dr. Neil, to your point, I think as a patient, the first thing for me is that, coming out to a provider is also a journey of trust, right? Like, I really need to trust you as a provider to be able to come out to you and to say, look, this is my sexual orientation or gender identity, and I need to discuss X, Y, Z with you because it is affecting my care, and I need you to help me understand how to do this. Now, to be honest, I am not formally out to my GI, though I know he knows, and he knows that I know that he knows. Because again, this is the context that I'm in, right? Like in India, it's not necessarily an easy conversation to have. Not to mention, sometimes you have family in the room. You may not be out to your family. I'm out to my mother. So it's fine for me to ask some of these questions. But other patients may not be out, right? And from a patient perspective, there's just so many levels of burden that you're navigating. Will my provider respect me still? Will I be discriminated against? Shit, I'm not out to my parent. How do I tell them to leave the room? Or I'm not necessarily out to the person who's there with me as a caregiver. How do I do I tell them to leave the room? And that's harder as a woman sometimes as well. It might, not to speak for men, but at least for me, it would be a challenge. Now, granted that I could tell my mother, Amma, shut up and leave the room, but still, from a gender role perspective, it is often challenging. So for me, one, building that relationship of trust between a patient and a provider is hugely beneficial. I would also reiterate that, you decide when you come out, and you decide who you want to come out to. So if you're comfortable with your provider, coming out has huge advantages. It helps you ask some of these questions in a manner where the provider can be informed of this as well. If you're not comfortable coming out, that shouldn't necessarily stop you from asking some of these questions. For instance, if it's about preventative health, we should all be informed about preventative health, regardless of whether we have IBD or CRC or IBS or not. But questions like, what are the vaccines that I need? What are some of the, perhaps it's discussions around PrEP. Having these conversations, regardless of coming out, based on your level of trust, is very important to help inform your care. The other thing that I will also add from a patient perspective is informing yourself and preparing yourself. Having a list of questions is enormously helpful as well, because it can be daunting to walk into an appointment knowing that you have 15 minutes to ask all of these questions. And this is a topic that's difficult to talk about. Pre-drafting your question might help you feel comfortable. That would be something that I would do. Questions around sexual function, again, could be quite challenging to talk about. If you prefer to have a one-on-one conversation, asking your doctor to have a one-on-one conversation is your right. as a patient, just as much as our families are important parts of our IBD journey or CRC journey. If you're not comfortable having family there, it's well within your right to say, I need to have this one-on-one discussion with my provider. Talking about sexual function, not the end of the world, not taboo, something we should all be doing if we have concerns. So that would be what I would do and what I have done in kind of advocating for my own care as well.
I
No, I
love
love
that.
that. Absolutely.
Madhura,
Ravjot,
one thing I
you?
do want to, oh, go ahead, sorry.
No, go ahead.
Madhura, one thing I would say is I love that you pointed out that people should definitely ask their, parent or the person who's there. They have the right to ask them to leave. And I encourage every physician, if you have a young person and they're accompanied by another individual, ask the individual in front of them, would you like to have this conversation in private? Because then you have taken onus as
Yeah.
the physician and said, I'm going to lead this and I'm going to give my patient the right to have this conversation in private. And then that way they're not, alienating their, parent or loved one or whatever, but they're giving themselves permission to be alone with their provider so they can have that private conversation. I want to make that something that every doctor does for their patient, right? Do you want to have this conversation without your husband here? Do you want to have this conversation without your parent in the room? And if the answer is yes, I immediately ask the parent or the husband, would you mind stepping out for a little bit? Please have some coffee while I have this conversation privately, right? And we have to take it on ourselves because sometimes it is uncomfortable for the patient to advocate for themselves and saying, hey, I need to have a conversation with you, doctor. I need my husband out of here, or I need my partner out of here, right? So I want every doctor to ask that for their patient. Sorry,
Absolutely.
Yeah,
Ravjot, please.
smiling because this is really important. Sometimes here in our IBD clinic, we have young people transitioning from a pediatric clinic to an adult clinic because they've come of age. And when I say pediatric to adult, they might be 22, 23, 24 because they've had a strong relationship with their peds GI. But if the parent often chaperones, right? Because they're nervous, they've usually been the advocate. So it's time for the young adult to try to learn to advocate. So sometimes I will sense how independent they are or not. And if I feel that they're like more quiet and the parents doing like most of the talking, which happens often, I will sometimes just open the door and be like, I'm going to do an exam now and I'll have a chaperone with me, like one of my medicals. And I'll just say, I'll come get you. I won't give them a choice. I just tell the parent to go, I'll come get you when we're done. And then I use that private time as part of the exam time, just as like, hey, I just want to talk to you in private. Because, sometimes we don't talk to the younger people enough about like sex, alcohol, drugs, which are really important, and my patients see me sometimes a lot more than their own primary care doctors. So it's a lot, but it's actually why I love being an IBD doctor because I get to get into like everything and I enjoy like trying to keep up with things. I wanted to ask you, Ravjot,
Dr. Neil, before we kind of move on from this topic, there's a question that says if a patient does bring this up and they're still dismissed, what can they do? So it'll be good to get both the patient and the provider perspective on that too.
Oh gosh, I would tell you to get a new doctor. That's my first instinct. Just like there's plenty of fish in the sea, that would be my first instinct, right? At the same time, you may not be lucky. I'm going first, sorry. I would say that if you get dismissed, look up for a new doctor or come back to your next visit with a partner. One thing I was going to suggest as a patient perspective, I love pre-writing questions about role playing, but sometimes having role playing goes a long way. And sometimes having your partner or your best friend there with you can help advocate for you. I was going to say some people are not always lucky to have another option, another consultant to go to. You might live in a rural area and you may not have a plethora of docs in that specific niche, right? If you still get turned down or you feel like you're being judged, oh my goodness, then you can't, you probably will have your care always be questioned by yourself, that are you being treated fairly? Do they have your best interests at heart? And you got to trust your gut, right? But I find that most of the time, not all the time, you'll be pleasantly surprised that they had implicit bias. They didn't realize it. They didn't ask. They didn't mean to dismiss you, but they did. It doesn't change the fact that they did, but they will probably appreciate and respond to being corrected. but it's very scary, I think, in the moment, right? So not all docs will be as empathetic as Kumkum, but I think you have to advocate for yourself and speak up, right? It's the only way, like, you know, if you don't stand up to the bully on the recess ground, right, you're always going to get bullied, right? If you don't stand up, right, to the system and speak up, it's going to keep happening, right? And I do think that old dogs can learn new tricks. I think that this can be unlearned. It's about, again, implicit bias is a hard thing to understand in your own self how to combat. We all have it. I have it, right? You have to fight that, right? So again, being cognizant. Kumkum, what would you say to that?
Oh, absolutely. I think it's really important that we make it a point as physicians to say, okay, what will make you comfortable? Sometimes they do want their partner to be in the room, right? It's, especially if that partner is aware that let's say the woman maybe she's with a new partner and who knows that she's had sexual trauma in the past, or she's been poorly treated in the past, or needs to have an advocate in the room. You have to give them that ability to say, hey, I actually want my partner here because he or she knows that I've had a really traumatic past, or I've had, domestic violence as a child, or I experienced abuse as a child. And that has really, really confounded my, sexual experience or my anxiety, and which has really exacerbated my IBS or my IBD and all these things that are very interrelated. And they're not comfortable speaking about it. But if they have the help from their partner, fine, let them be there. But if, and you're exactly how you said, if you sense that there's a young person or a child that is, autonomous and having experiences that they don't necessarily want to disclose to their partner or their parent, it is our job to allow that adult child to say, okay, I want to have a conversation with my doctor, and it's time for the other chaperone to take a seat outside while we have a one-on-one with the adult child.
Mhm.
And Ravjot, let me know how this went for you, because I know you experienced this as a young adult.
Yeah, what was interesting for me is like luckily my dad is also he's kind of in the field himself. He's a cancer researcher and a very prolific one at that. So go dad. And actually he worked on CRC and a bunch of drugs as well that ended up coming out for CRC amongst many other cancers. He's also tackled lung cancer, brain cancer, a bunch of stuff. So he's a cool dude.
Amazing.
That being said, you don't always want to discuss things in front of him. For example, my parents do not know in the fullest context that I am out. So especially early on, again, that never came up in our discussions anyway, because the doctors did not know 12 years ago to ask about these things. Even if they had, I probably would not have answered honestly, because a lot of the times I would have to take my dad with me specifically to be heard, especially around one particular Desi male doctor who just was not on my team. I don't know why he wanted to see me die so bad, but anyway, he almost accomplished that. But luckily, yes, my dad came in with me. Luckily, some doctors were really well versed, and they did ask, "Hey, are you sure you want to be talking about like the colon, the rectum with your dad there?" And luckily, I was comfortable enough to be like, obviously, it's not a sexual thing, right?
Mhm.
So, and my dad understood that very well too, which was awesome. So he ended up being a pretty big advocate for me. But I'm grateful for the docs. Yeah, go dad. I'm grateful for the docs who both asked, to clarify that comfort level, and also who often told him to leave the room for certain examinations and stuff. So I'm really grateful for the people who really were well versed in how to tackle these really sensitive subjects. But yeah, he was a big advocate.
I think I'm so happy, and thanks to your dad professionally for what he's done for cancer patients, and what a great dad Father's Day is this weekend, and that's a beautiful thing that he's been your advocate. I don't think everyone is lucky to have supportive parents, especially when it comes to their own sexual gender and identity. I think Desi culture's come a long way, but I think that, I think if you're affluent, you experience it one way, and if you're not, it's very different. And contrary to popular belief, not all Desis come or South Asians come from wealthy families,
Yep.
and it really changes the patient experience. I digress a little bit, and we only have a few minutes left, and I feel like I could keep talking to you guys. I want to, if you don't mind, there may be things you wanted to say that you didn't get to say, or there may be points that you want to leave our audience with. On this Pride Month for this year, we'll do this again, but are there any parting words or messages that you feel that you would like to leave with our audience that they can be an advocate for our community? Anybody can go
Ravjot, go
first.
first.
Okay, thanks for putting me on the spot. I will say that it's a lot of spaces coming together in ways that are actually really difficult to juggle. Whether it's, our race, whether it's being queer, whether it's being diagnosed with a chronic illness and now having to live with it for a really long time. But one thing that I did want to bring up, actually a few things. First is that there is actually a massive network of people who exist at this very intersection, and my life really changed when I
Yeah.
started talking to them and when I started to get to know them. There are so many folks that are doing this work. First off, you all, and then there's so many patients as well that are doing this work, and it just helps you feel less alone, because especially at the beginning, I think when you're diagnosed with something big and it's very scary and it's life threatening, or you're kind of confronted by the aspect of dying all the time, I think spirituality gets called into question a lot, and you suddenly start wondering, am I in error? Does God love me? Does this universe want me gone? Especially when you feel like a lot of the people that are supposed to be helping you, like whether it's doctors, researchers, are not on your side. So just they came along very late into my journey, where I met other people like myself. But when I did, I feel like it really helped heal the parts of my young self that maybe used to question, like, am I supposed to be alive? Am I supposed to be here? Does God love me? Like all of these questions, I was like, of course God loves this other person, so I think they love me too. So I think just having that community helps a lot. And again, there are thousands of awesome South Asian, queer, chronically ill people that are online that are putting this work out there. And another thing that I wanted to say is that there certainly are resources that really did not exist a few years ago that help you find doctors that are allies, or even queer doctors themselves, and that extends to other fields as well. Like there's a lot of wonderful allies and queer therapists now too, which did not exist a long time ago. And there's a lot of like regional resources through these incredible nonprofit organizations. And if anyone's in need, they can DM me. I have like a whole list of them, and I'm very connected to like a lot of folks who work in certain regions on these issues. And I'd be just super happy to connect folks to these nonprofits that help connect patients to queer doctors or allies. And especially in an era where like our healthcare as queer folks, and especially as for trans people, is under attack from the administration. I think it's really important to say that not only the queer community should be advocating for themselves, absolutely, but the burden should not be solely on queer folks or trans folks. So there's other ways that doctors and healthcare workers, nurses, researchers can continue to like push for that care to stay in their state and stay in their facility, and work with the queer community, because the attacks are pretty crazy right now. And I just really hope going forward that this doesn't have to come into question anymore, and that the rights of real people are not at risk. So I think it's really important right now for the healthcare community as well to advocate for keeping that care and expanding it rather than diminishing it.
That's beautiful. Thank you, Ravjot. I totally agree. I think a couple of things I took away. You're not alone. If you're South Asian queer, there's many resources, and that's very generous of you, Ravjot, to offer any resources if people DM you. So thank you, community. Thank you, Ravjot. Two, I think this world that we have traditionally living in until recent political times, the beauty of where we are, at least where I'm blessed to be in America, was that you could enjoy being different and unique and be appreciated. And the moment that society or political powers that be start to single out one group, don't you think that you're not immune to being the next group to be singled out?
Yep.
We all have to stand up for each other and appreciate each other, because it's not just upon, like you said, the queer community to advocate for themselves, right? Just like it's amongst us, on all of us. It's a human right to exist and be. And so this is really humanity that we're talking about, right? Not just country state lines. Madhura, are there any parting words that you have for our community or messages you'd like to
Yeah.
provide or encourage?
It's so hard to go after Ravjot and Dr. Kumkum, I have to say, oh my God. So let me just add to this theme, right? Like, I think in a world where you feel like you don't have a place anymore, where your place and your right to be who you are is constantly being questioned, it's very challenging to navigate that, right? And there's this, I mean, I'm sorry to quote a reel, but there's a reel that goes around where there's a little child who's learning to swim and her coach says, you're big, you're brave, and you're beautiful. And I will just echo that message that you're big, brave, and beautiful. You matter, and you have a right to be here for who you are, and you matter for who you are. So that's my message to the queer community on Pride, on any other day. And I will also add Pride needs to start becoming more inclusive of those of us who have invisible chronic illnesses, especially. We also deserve a place to be at Pride. The second thing that I will say to add to Ravjot's very generous offer of resources, couple of resources in the GI space from a physician perspective, Rainbows and Gastro doing fabulous work. From a patient perspective, Girls with Guts, hit us up at SAIA. We are also trying to support our South Asian queers as well as other South Asians with GI diseases. And really lots of resources from the Crohn's and Colitis Foundation as well as the AGA to help support patients and providers who may be LGBTQIA or who may want to support members of the LGBTQIA community. And to all of you, thank you so much for making my heart feel so full this Pride.
Thank you, Madhura. Kumkum, any last things before we sign
Yeah,
off?
yeah, absolutely. You know, being South Asian comes with its own set of, journeys and difficulties, right? We are dealing with our old generation of parents who bring their stigmas. They don't address mental health. They don't address sexual health. They don't address access. And then on top of that, to add gender and sexual identity is so difficult. So kudos and thanks to everyone in the LGBTQI community who is going out there and doing that. The biggest thing that I would encourage any person, regardless of your sexual preference or orientation, is to advocate for yourself and bring it up. If your doctor is not well versed, make them well versed. Give them the opportunity to try, and if they're not trying, then yes, it's time for a new doctor. But give them the opportunity to know, hey, I've had mental health issues that are, affecting me, sexual health issues that are affecting me, and this is all connected to my current, well-being and my GI issues. Because as we know, the gut is really important for mental health, right? The gut brain axis. So everything is connected, and it's our job to help you. And we want you to be able to help us help you back. So please help us. Thank you.
Thank you, Kumkum. Thank you, Dr. Patel. I want to thank all of our guests today. Madhura, Ravjot, Dr. Patel, thank you so much for being here and taking the time out of your busy day, wherever you are, whatever time zone you're in, to join us for this conversation. And to all of you who tuned in, this live will be on our SAIA Instagram feed, and you can share it. You can share it, and we encourage you to send it, DM it, so people can watch it, okay? I am very, very lucky. Thank you, SAIA, for inviting me to host and moderate this conversation. Here at SAIA, South Asian IBD Alliance, we believe that we are a nonprofit organization that's truly poised to advocate for equality, advocacy, equal health rights. We stand with our queer community shoulder to shoulder, and we're really proud to.
Dr. Neil, you've cut out again.
Neil, your sound cut out.
Somebody called me. I said, on behalf of SAIA, thank you all so much. We appreciate all of you tuning in, and we hope to do this more. So wonderful having you all. Have a wonderful day and a great weekend.
Thank
Happy
you.
Pride.
Thank you
Happy
so
Pride.
much. Happy
Happy Pride.
Pride.